Today we're going to look at lower back pain. Now, lower back pain is the most common complaint that people have regarding their spine. And we sit a lot, we overexert from lifting things, we drive long periods of time, situations, slip and falls. There's reasons why we have low back pain. Matter of fact, researchers have shown that 80% of the population will suffer from low back pain sometime in their life. So we're going to demonstrate just how we evaluate a lower back condition, because if we can find physical, objective findings that says something is wrong, then we can see if chiropractic can be of help. So the process is to see how things move. After all, pain comes when you have inflammation, which is caused by something pinching or rubbing, causes things to swell, causing inflammation and pain. So if everything is moving properly, then there is no pain. So let's take a look. So if I'm to see how the back is moving, bend forward like you're touching your toes, okay? And we're looking to see if you can bend here, or if it stops halfway because there's pain. Going backwards, okay, good movement. Again, the same thing. When we look at the bend to the sides, if the movement is restricted, and then the other side, okay, then that tells us there's something on this side or the other of concern. Now, if you take your hands and then turn this way, right, and then turn this way, okay, again, the comparison is. Then we can do some provocative tests to force the joints into position to see if it aggravates or causes the pain to come back more so. So I'm going to have you lay on your stomach, please. And we'll then actually palpate the spine. So that was like a motion study. Now we're actually feeling the spine and feeling if it feels different on the left and the right, if the muscles are tight or spasm. And muscles sometimes are the reason, but most often is that the muscle is reacting to something underneath. Typically a spinal misalignment. Now the other thing that we do are orthopedic tests. So raise your legs straight up, okay, knee straight, like this, and no coaching here, huh? Up we go, straight up, that's it. Here we are, and down, and then the other side, just like that, okay? So I can feel if the joints here are moving or they're jammed up. Bending your knee, and I can feel how the spine is shifting to the right or to the left. Various orthopedic tests, okay? And then that helps me to determine if this issue is in the back pain. Back pain is like, I have back pain, but where is it? Well, it's either in the pelvic joints or in the lumbar spine, and this helps to pinpoint specifically where it is. So turn on your back, please. So a couple of additional tests, like orthopedic tests, where you can see how high the leg goes up, where you can bend the knee and bring it to the side. Again, comparing right side with left side, and to see if there's any area of abnormal movement. Okay, we start with that. Every time these tests are done, raise your legs up together and hold that. See, when the back is really painful, you cannot do this. You cannot hold your legs up. The pain is so severe. Bring down. So these types of tests help to provoke or re-aggravate the pain and helps us to pinpoint where the pain is. Now, that is the basic Lumbo-Pelvic chiropractic evaluation. That tells me, okay, I'm going to get an x-ray to include the pelvis or just the lumbar spine, and then we'll be able to, with an x-ray standing up, because we need to be able to see the weight of the body on the joints to see where the misalignments are. So once we look at the x-ray, match it up with these orthopedic tests, then we know where the problem is, and then because it is a chiropractic problem, then we have solutions. And these solutions are natural. Spinal adjustments, manual manipulation of the spine to make a correction, and then some strengthening exercises and discussing. Let me tell you about lower back problems. Lower back problems can affect female organs. They can cause all kinds of problems, from infertility to abnormal irregular periods to cramps that are painful more than they should be. They can affect your bowels, where you can have incomplete movement or you can have too much movement. They can pinch the nerves going down into your legs. They can affect the nerves that control the muscles, where you've developed weakness and now you developed a knee problem because you had a lower back problem. And then, of course, the lower back can cascade up into the neck. So a spinal evaluation normally includes the whole spine, but I demonstrated here how we approach lumbar spine evaluation.